The Efinaconazole solution with applicator is used to treat toenail infection caused by fungus. It works by stopping the growth of certain types of fungus. This medication treats only fungal infections and will not work for other types of infection, such as those caused by bacteria. It is important to use this medication only as directed by your doctor to avoid decreased effectiveness. Make sure to follow the daily dosage and apply it at the optimal timing recommended by your healthcare provider. Before using efinaconazole, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for guidance. To apply this medication, start by cleaning and drying the infected toenails. Wait at least 10 minutes after showering, bathing, or washing before applying. Use the provided brush to apply the medication to the infected toenails, making sure to cover the entire toenail, toenail folds, toenail bed, and under the edges of the toenail. After applying, wash your hands. It's important to use this medication regularly at the same time each day to get the most benefit from it. Continue using it for the full time prescribed, even if symptoms disappear after a few days. Nail fungus treatment usually needs to be continued for a long time in order for healthy nails to grow and replace the infected toenails. Stopping the medication too early may result in the infection coming back. If you're using this medication on a child, make sure an adult applies it for them. Also, avoid getting the medication on any other part of your body. If this accidentally happens, wipe off the medication and rinse thoroughly with water. If your condition does not improve or if it worsens, make sure to inform your doctor. And remember, since this product can catch on fire, do not use it near heat or an open flame. If you experience irritation, pain, blisters, or an ingrown toenail after applying this medication, stop using it and contact your doctor or pharmacist. It's important to note that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you experience symptoms such as a rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, report side effects to Health Canada at 1-866-234-2345. Before using efinaconazole, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other antifungal medications. This product may contain inactive ingredients that could cause allergic reactions or other issues. Be sure to discuss your medical history with your doctor or pharmacist before using this medication. If you are planning to have surgery, it's important to let your doctor or dentist know about all the medications and products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use this medication if it is clearly necessary. It's important to talk to your doctor about the potential risks and benefits. It is unclear whether this medication passes into breast milk, so it's important to consult with your doctor before breastfeeding if you are using efinaconazole. When using efinaconazole solution with applicator, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If this medication is swallowed, it can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of an overdose, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. Sharing this medication with others is not recommended. This medication is specifically prescribed for your current condition. Do not use it for any other condition without consulting your doctor. If you have a different condition, a different medication may be needed. If you forget to use the medication, apply it as soon as you remember. If it's almost time for the next dose, then skip the missed dose and continue with your regular schedule. Do not apply extra medication to make up for the missed dose. Make sure to store the bottle of Efinaconazole solution with applicator tightly closed and in an upright position at room temperature. Do not freeze it, and keep it away from heat or open flame to prevent it from catching on fire. It's important to also keep all medications away from children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this safely. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.